I'm Dr. Antonio Strafella, and I am a movement disorder neurologist at the Toronto Western Hospital, Cranbrook Brain Institute. I'm also the Director of Clinical Research and Translation at the Temerty Faculty of Medicine, University of Toronto. It's Parkinson's disease, which is a brain degenerative disease that manifests over time with multiple symptoms, including motor, cognitive, and behavioral complications. And these neurological symptoms tend to worsen over time with the progression of the disease. And the majority of patients present in our clinic with tremor, slowness in movement, impaired balance. About, I would say, 40 to 60% of Parkinsonian patients manifest different forms of complications associated with cognitive performance, with a range going from executive dysfunction to more severe forms of cognitive decline involving dementia as well. Executive dysfunctions are mostly problems associated with short-term memory and I would say probably day-to-day activities. Is definitely in the Alzheimer is way more aggressive with severe, of course, behavioral changes and hallucinations. In patients with Parkinson's disease, the form of dementia is still less severe than what you see in Alzheimer. Maybe you can have patients tend to experience a certain degree of visual hallucinations, but the disruption in behavior is not as severe as seen in Alzheimer's disease. The causation is different from Alzheimer's disease in the sense that generally the Parkinson's dementia is the result of a combination of different proteinopathies. Generally, we know that alpha-synuclein is the main proteinopathy in Parkinson's disease. And of course, sometimes you have also a combination of amyloid, but this is quite different from Alzheimer, where instead you have a predominantly amyloid and tau proteinopathies that are responsible for their symptoms. My research tends to focus mostly on biomarkers, particularly imaging biomarkers. We tend to use sophisticated and advanced technologies to image the brain and to quantify mostly molecular and chemical changes that are occurring in vivo in patients with Parkinson's disease. So the main focus of my research has always been on Parkinson and Parkinsonian disorders. Historically, the main treatment for Parkinson is always associated with dopaminergic treatments, right? So like levodopa, for example. And so levodopa, because it's a dopaminergic drugs, and we know that the dopamine is very important for motor symptoms and also non-motor symptoms in Parkinson's disease. So this has been the main approach so far for the past number of years. But now the approach is actually to move away also from levodopa and see if, for example, by using, let's say, antibodies therapy, like trying to reduce the amount of alpha-synuclein, for example, in the brain, is there a chance that we can change the trajectory of the disease? This is the same approach that has been used also for Alzheimer, for amyloid, and potentially tau. The future is bright and quite promising for Parkinson research. So, I mean, we have a new drugs in the pipeline that in the next few years, and also we have important discovering that is associated with advanced technologies, without considering the future use of artificial intelligence, how this will influence research in Parkinson and Alzheimer as well. We still don't know, but we know that in the next 5-10 years, I mean, there will be significant discoveries that will change the course, the trajectory of the disease.